Good afternoon, everyone, or good evening, or good morning, depending on where you're joining us from. If you are unable to hear me, please just type in a message into the chat. I wanted to say thanks to everyone for participating and joining us today for an informational session from the Department of Pharmaceutics at the University of Washington. I'm going to go to the next slide. I am Melissa Barker-Holiski. I'm an associate professor and the graduate program coordinator in the Department of Pharmaceutics. And I'm joined by my colleague, Dr. Nathan Gwen, who is our graduate program advisor. Nathan is manning the Zoom session, but we are both here to provide input and answer some quick questions that you might have about admissions to our program. There's a URL at the bottom of this introduction slide, just again with more details about admissions into our program. So to kick things off on the next slide, I wanted to just kind of give a quick overview of the University of Washington, the Health Sciences campus complex at the University of Washington Seattle campus. I've got a couple photos, just aerial views of Seattle and the UW campus in particular. The top left picture with the fountain is mostly upper campus of Seattle campus. So you can see where the library is and a lot of beautiful view looking south towards Mount Rainier. On the top right column or picture is the University of Washington Medical Center. This is where our building and our department is located. The bottom left panel is Seattle in the spring. It's somewhat well known that the University of Washington Seattle campus has a number of beautiful cherry trees that were gifted from Japan in the early 1900s and are quite beautiful in the spring to go get a peek of. This is just one really pretty picture of it. And then the bottom right panel is a photo of our newest health sciences education building, which is where a lot of our classes are offered for graduate students in our program. So this particular health sciences education building is a building that has been exclusively dedicated to classrooms. There are no research laboratories. There's a lot of collaboration and team working space. There's a lot of classrooms that are designed for hybrid learning or various instructional modalities. So it's really a state-of-the-art classroom and really some fantastic classes that go on in there. And I have one starting next quarter in winter. All right, next slide, please. Again, we have some additional photos kind of where the University of Washington Department of Pharmaceutics' program is located. The top left picture is just looking at where our actual departments are located. The School of Pharmacy is in the top left photo. That building actually looks over the bottom, the water, the Montlake Cut, which is a bit of water connecting South Lake Union and Lake Washington that actually connects us in some ways to the sound, the Puget Sound. The big building on the bottom right is again an aerial view of the University of Washington Hospital and the Health Sciences building and the Magnuson Health Sciences complex. The purple arrow points to where we are located. You can see how we have a great view of the water in the summer, and sometimes you can see Mount Rainier from various laboratories in the school. It's a really beautiful location in proximity to a lot of the resources that Seattle has to offer. I want to highlight for you that the National School of Pharmacy rankings place the University of Washington School of Pharmacy as number 8 out of 130 schools or colleges across the nation. So we are a very well-respected school of pharmacy, and we have a lot of resources available to us. I want to just highlight for everybody too a few strengths about the School of Pharmacy and the Department of Pharmaceutics in particular. I want to point out to you that Health Sciences building at the bottom right is also proximal to the hospital. So that puts us in proximity to the School of Medicine, School of Nursing, School of Public Health, Environmental and Occupational Health Sciences, and the School of Dentistry. So because we are so closely located to many of the allied health professions, We have tremendous access to translational and impactful research that can have a direct impact on patients' care and healthcare related outcomes. That also gives us a lot of opportunity for collaboration. And the work that the Department of Pharmaceutics does within the School of Pharmacy has largely focused on drug metabolism, transport, distribution, and absorption to deliver the right medicine to the right patient at the right time. Our work tends to span, and we'll get into a little bit more in a second, but our work tends to span the molecular, cellular, and organ-based studies in humans and animals and mathematical modeling and simulation. And our research, it really sits at the forefront of understanding how medications are enter the body, how exposure happens and the pharmacological response of medications to drugs. We use physiological models to understand both the effects of both health and disease, and use information about genetics and environmental impacts to understand the metabolism, transport, absorption, and distribution of drugs throughout the body. All right, next slide, please, Nathan. So again, this is highlighting kind of what we are recognized for in the Department of Pharmaceutics. We have a very broad research portfolio that's focused on drug metabolism, drug delivery, drug disposition, and drug action. A lot of the work that is conducted in our department is what we would consider bench to bedside or translational research. Folks are doing multidisciplinary research studies where they're working with investigators in the School of Medicine, departments of neurology, departments of nephrology, to understand how changes in human patients might be modeled in preclinical systems. I want to highlight also that the faculty are very collegial, and as a result, this leads to a lot of exciting collaborations within the school, both within and outside the University of Washington. There is often many opportunities for folks coming into our program to work not only with their primary advisor, but with various other faculty mentors within the department and within the school, because we're all collaborating together. One important topic to mention also is that we have a fairly individualized curriculum. We have a prescribed set of required courses, but we also have opportunity for a number of electives that are up to the trainee and their faculty advisor. And we also have a small faculty body, which means we have excellent one-to-one mentorship opportunities. Typically, the students can meet very frequently with their advisor to get mentoring, but there's also many opportunities for interaction with the faculty who are not their primary advisor. And finally, we have a very robust relationship with industry mentors, and this allows us opportunities for internships, training, or having industry advisors sitting on graduate dissertation committees or providing input on research directions. And that has helped to facilitate the future directions of our students in getting jobs in industry or getting additional training opportunities. So there's quite a bit of opportunity for engagement to meet your training needs within the department. I also will just comment too that for this info session, if you have questions, we're going to save them to the end, and then you can just put them in the chat or unmute yourself if necessary. So on the next slide, I'd like to cover a question that I often get. So I'm a trained pharmacologist, and I get this question a lot from students in my laboratory, people I meet in national and international conferences, which is, how is pharmaceutics different from pharmacology? And I want to emphasize that pharmaceutical sciences really focuses on what the body does to the drug, understanding how the drug is delivered to various organ systems or tissues, understanding the mechanisms and extent of absorption, how the drug might be metabolized, how it's distributed throughout the body, and how it can even be excreted from the kidneys or in fecal matter. And understanding how these processes interact to influence the action of a drug. And so we've got on the right-hand side a kind of a graphic showing, absorption. How does it get into the body? What is and distribution? Where does it go once it's been ingested by the oral route? Third is looking at metabolism. How is that drug eliminated from the body? So in a chemical transition process so that it can be actually removed from the body through excretion. This is very different from the field of pharmacology, which tends to focus on what a drug does to the body. So it's looking at how the drug interacts with a receptor or molecular target. Pharmacology tends to be a little bit more basic in nature and understanding just what is the drug, what is the molecular target, what's the interaction with that organ system, and carrying it into in vivo studies, but not so much the holistic understanding of the relationship between how drug exposure influences the pharmacodynamic or biological effect of the drug and the intended action. So that's really the big difference between pharmaceutics and pharmacology. Pharmaceutics tends to be a little bit more applied and translational in nature because we're trying to move from not just knowing about the molecular target, but trying to understand how the drug might work in the body so that you can get the intended effect. In the next slide, we have kind of an overview of the faculty within our program. So we have 10 faculty at this time who are actively engaged in graduate student mentoring. And the faculty research areas tend to fall into a couple different kind of umbrellas, if you will. The first umbrella is the group that's largely focused on drug delivery, translational aspects of drug delivery, how changing the delivery of a medication can influence its pharmacological or therapeutic activity. You know, if you change the route of administration or change the absorption kinetics, that might improve the therapeutic benefit of a drug. And so the folks that are working in the drug delivery space include Dr. Rodney Ho, Dr. Shijik Hao, Dr. Jay Panyam, and Dr. Swayam Prabha. And then the next group that we have is the drug metabolism and pharmacokinetics, pharmacodynamics group. These folks tend to be focused largely on understanding the biological effect of drug, but also how it might be eliminated or how it might be changed metabolically. This includes Dr. Sam Arnold, myself, Dr. Melissa Barker-Holisky, Dr. Nina Eiselharanen, Dr. Ed Kelly, Dr. Yvonne Lin, and Dr. Joanne Wong. Next slide. Here's a quick snapshot of our program as of this last summer, June 2025. We had a large reception honoring a retiring professor, Dr. Ken Thummel, who had been with our program for a number of years. Our current student body includes 21 PhD students, 12 master's students, and 6 postdoctoral fellows. I want to emphasize that we tend to be a very tight-knit and collegial group. We have departmental get-togethers kind of on a quarterly basis or some sort of informal activity where we can all get together and interact. We have a close relationship with the Department of Medicinal Chemistry, which also has a complementary research focus. And because of this complementary relationship, we also have joint seminars with the Department of Pharmaceutics and Medicinal Chemistry. We tend to collaborate a lot with individuals in that other department. And our graduate students are all in the American Association of Pharmaceutical Sciences, so the AAPS chapter. And so they have activities and events together with both PCEUT and medicinal chemistry. Combined, these two departments have about 60 graduate students, and they do a lot of social activities and academic interactions. We have a shared research seminar, PCEUT 520, that's offered every week, where we have speakers from both departments or outside speakers that are of interest to both departments that can come and interact. So it tends to be a very collegial group with a lot of opportunities for scientific engagement and interaction. Next slide. So our PhD program has typically consists of in this following track. So we have about 5 years of funding that's renewed on a yearly basis. We typically admit about 2 to 5 students from an application pool of around 90 to 140 students. In the first year of the program, a PhD student is required to conduct 3 laboratory rotations. And after the end of those laboratory rotations, they should have selected an advisor by the end of spring quarter. Now, there are certainly exceptions to this rule as far as potentially having a 4th rotation, but we typically don't allow for 4th rotations unless there are extenuating circumstances. We believe that you should be able to find a great mentor relationship by the end of your 3rd rotation. Additionally, at the end of your first year, you should have completed most of your core classwork, and we're going to get to the actual classwork in a second. So that allows you the 2nd to 5th year in the program to largely be devoted to research, your dissertation research within your primary mentor's laboratory. The dissertation document at the end of the 5 years on average should consist of about 5 chapters, although that can be subject to discussion with your PhD advisor. There should be about 3 data chapters, and those should typically be a publishable paper. And our mean graduation time for our PhD track students is about 5.5 years in the program. So what does the first year of the PhD program look like? The first year sequence is here on this table. So you can see that in our first year, our students are taking a large first quarter on quarter. We are on a quarter system at the University of Washington, which may differ from some institutions that are on semesters. So we have 3 academic quarters during this winter or autumn through spring, and then we also have summer quarter. So autumn quarter consists of biostatistics. This is a statistics class. And then we have PCEUT 502, 505, and then these are our required courses on drug delivery and pharmacokinetics. And then a 520 seminar, which, as I mentioned earlier, is shared with the students in the medicinal chemistry program. And PCEUT 583 is a journal club where the students meet once a week to review relevant literature that's keeping up with the current state of literature. And students then also are able to do their PCEUT 600, the research rotation, where they're spending about 1 to 2 credits per academic quarter in a research laboratory dedicated to research question decided with their thesis or their advisor for the rotation. So that research rotation, PCEUT 600, tends to vary depending on the laboratory, and the format of it will be dependent on the advisor. In winter quarter, students take a number of other courses, including medicinal chemistry coursework. You can see that the PCEUT 520, 583, and PCEUT 600, those 3 classes stay the same across all 3 quarters of the first academic year. But the spring PCEUT 506 class is another pharmacokinetics, advanced pharmacokinetics class that all of our PhD students are required to take. And sometimes, depending on the student's interest, spring quarter can also allow for an elective, which all of our course descriptions and the electives that are available are currently listed online on our student handbook if you're interested in learning more about the course load. So next slide, please. The PhD program does have 2 exams, standard exam requirements, and this includes a general exam at the end of the 3rd year, which includes a written exam, written grant proposal, that we have a course that is provides students with some training in how to develop that grant proposal in combination with advice from your primary advisor. But then the student is also asked to conduct a cumulative oral exam, which can be on any subject within the general coursework, the required coursework, relevant to the research proposal written, or relevant to an elective course. But it's generally meant to kind of assess the cumulative training and critical thinking that the student has obtained during the first 3 years of their dissertation research. If a student successfully passes the general exam, they are advanced to PhD candidacy, and that allows them to conduct the remaining work to support their dissertation research. And once the dissertation research has been conducted and a dissertation document has been drafted, a student is then undergoes a final exam where they submit their written dissertation. They provide an oral public presentation of their dissertation research and defend their dissertation research to their dissertation committee members in a closed door session after the public oral presentation. Next slide, please. So our students have a lot of opportunities for training beyond just the didactic coursework and their laboratory research. We try to engage students to attend at least one national or international conference per year. Things like the AAPS meeting, ISSX, ASPET, Society for Neuroscience, Society for Toxicology, Gordon Research Conferences, you name it. These conferences have all been attended by our students in the past, and typically those meetings are determined in discussion with the thesis or the dissertation advisor. Additionally, our students have access to a few pre-doctoral training programs. For example, we have a T32, a training grant that is offered jointly with the pharmacology and medicinal chemistry departments called the Pharmacological Sciences Training Program. It offers 1 to 2 years of research support covering the student's stipend during the second and third years of the student's time in the program, or they're eligible in the second and third years of their time in the program. There's also the TL1 training grant that's overseen by the Institute of Translational Health Sciences, as well as other training grants through the School of Medicine, School of Public Health, even fellowships or other opportunities that your advisor might know about. We also have a number of departmental awards that can help support students attending travel or attending conferences, presenting their research at national or international meetings. The graduate school offers a really nice training travel award for students, and even some of professional societies offer travel awards on an annual basis, and those are competitively awarded and can be obtained in consultation with a dissertation advisor. Students have the ability within our program to conduct industry or FDA internships. These are usually in the summer quarter for the students. We advise to have it be second or third year in their program, sometimes later, depending on your own professional goals. I, for example, did an industry internship when I was a graduate student. I think it was a really valuable opportunity, and we do encourage our students to take advantage of those opportunities wherever they can. Next slide, please. So the UW research ecosystem is quite robust. There are a lot of different institutes and centers that can provide research training. I'm not going to go into too much detail about these opportunities, but lots of information is available online if you'd like to learn more. So next slide, please. So where do our students go? Well, due to the unique translational and multidisciplinary nature of our training, our students are very highly sought by potential employers. Our students tend to focus on industry or translational research opportunities. Maybe only about 30% of our students go into academia, but a lot of them go into industry roles. Our students have been employed previously by research institutions and foundations as well, things like the Bill and Melinda Gates Foundation. We also have students who have had a track record of starting their own companies or being entrepreneurs, because the research that we do and the students that we tend to attract tend to be very focused on translational or applied research. Next slide, please. So here's a little bit more of the nitty-gritty details. How do you apply for our PhD or MS program in pharmaceutics? Well, the application deadline for the PhD program this year is December 1st. Admission requirements, we require a 4-year bachelor's degree in a biological or related sciences with a GPA greater than or equal to 3.0. We do require differential calculus, college level differential calculus, and the University of Washington sets the requirement for English language proficiency. The GRE is recommended, but it is not required. If you have a GRE, if you've taken a GRE, we certainly will look at it, but you're not required to submit it. All applications need to go through the University of Washington centralized application program, and so you can find information on the link in the slides. The documentation that's required includes the application form and a $90 application fee. We ask applicants to write a statement of purpose, and we hope that your application or statement of purpose will be tailored to our program to allow us to better understand how you might benefit and fit within the program. We require a resume or a curriculum vitae. We require 3 letters of recommendation, and we require that you list the names of the research labs that you are particularly interested in. This helps us to understand which students might be interested in particular labs, depending on funding availability and whether or not advisors are thinking of taking a student in that particular year. We appreciate a transcript of your bachelor's degree and a personal statement and your English proficiency scores. So lastly, why should you apply to the University of Washington Pharmaceutics program? Well, it's a national and internationally recognized training program. We are consistently ranked. Our graduate program is consistently ranked amongst the top 3 in the nation, if not worldwide. And our research, as I've highlighted, hopefully enough already, tends to be very multidisciplinary and translational in nature. We tend to have work that can move to the clinic in a few years. Our studies span cell or in vitro systems, tissue models, whole tissues, and all the way up to in vivo studies in animals or in humans. We tend to offer an individualized curriculum that's largely tailored to the trainee's professional goals. And our labs tend to operate very closely and collegially. The department as a whole tends to operate like a small family with a diverse and collegial atmosphere. You see a picture of some trainees carving pumpkins a couple of years ago. So we tend to have activities together frequently. And I want to emphasize that all faculty participate in the graduate student training and mentoring. So we tend to be very engaged. Next slide. We also have an extensive alumni network and a mentoring program. We allow trainees to bring industry advisors to serve on their dissertation committees. Students typically graduate or have about 2 to 3 offers before they graduate. And the pharmaceutics faculty alumni tend to have successful careers in academia, federal, state governments, and other research institutions. I'll jump to the next slide. You can see some snapshots of quotes from prior trainees, but I'll get to the next slide, which is my favorite, which just highlights, why Seattle. And Seattle is a really dynamic and urban big city. There is something truly for everyone. We are close to the Puget Sound. We are close to many freshwater lakes, or actually not close. We are sitting on several freshwater lakes. We're close to the mountains. So if you like to ski, snowboard, hike, mountain bike, there's lots of opportunities for outdoor activities, or lots of opportunities for outdoor activities. We also have a very vibrant art scene. There's a really great glass blower, Julie, that has the picture at the bottom right. It sits right below the Space Needle. So there's lots of art in the area that you can catch. If anybody's paying attention to the Major League Baseball, ALCS right now, the Mariners are playing in that right now. Hopefully we'll see a World Series team in the future. And we have a diverse population. The Seattle area also has a very convenient public transportation system. We have both light rail and buses and trains, and there are lots of restaurants and coffee is everywhere in Seattle. So there tends to be something for everyone. And so with that, I'd like to open this session to any questions. And if you don't feel comfortable asking your question here today, that's totally fine. Please feel free to email Nathan at the email address that you see up on the screen. And we appreciate your time and thank you for your attention.
Right, cool. So Melissa, you have a question here from Henry. So he asked, is it possible to apply with a master?
Is it possible to apply with a master's degree? It absolutely is. We tend to see students apply with those degrees very frequently. So please send us both your transcript from your bachelor's degree and your master's degree program.
Next question from Austin. If I am expected to graduate in 2026, am I allowed to apply for this current cycle?
Assuming you have a bachelor's or you plan to have a bachelor's degree, yes, you are absolutely welcome to apply this current cycle.
If you have more questions, please type, or you can even unmute yourself and talk to us.
Great. Well, if you have no further questions, we'll.
Oh, we have one more, right. Where should I begin to look for potential labs of interest to list in my application?
Yes, so our website, I think it's at the first slide.
Yes.
Our website has a list of all of the faculty labs that you can see. So as I mentioned too, there's about 10 faculty who are actively involved in graduate training. Dr. Ho, Dr. Powell, Dr. Panyam, Dr. Prabha, Dr. Arnold, Dr. Barker Holiski, Dr. Isa Haranen, Dr. Kelly, Dr. Lin, Dr. Wong. Those are all faculties that have websites that you can check on the school's Department of Pharmaceutics program website, see what kind of research they're interested in doing. And hopefully that can help you kind of narrow down your interests.
So we have a question about what are the specific requirements for the PhD in our program. So we already covered that. So if you could send me an email, I can give you more specific info. So we'll move to the next question. Okay, this is a good one. Is it recommended or required to contact a potential faculty advisor before applying?
Yes, so you are welcome to contact a faculty advisor before applying, but I would not expect a one-on-one interview or some sort of meeting with the faculty just due to the sheer volume of inquiries that faculty get. But it does not hurt to send if you find a faculty member that you're interested in their research, send them a query just saying, hey, I've found your research very interesting. Are you considering taking students? You may or may not get response, but that can help us know, who's interested in the labs, the various labs, and it doesn't hurt to express that interest.
Right. Next we have, may I submit my GRE report at the time of application?
Yes, you may absolutely send your GRE. If you're comfortable submitting your GRE scores, it's not required, but we do use it sometimes for secondary evaluations, but it's not a requirement.
Okay, next question. What type of financial support are typically available for PhD students? And do these financial support include health insurance coverage?
Yes. PhD students are, if you have a academic student employee appointment, or an RA-ship as we call it, you are eligible for a stipend. The stipend rates are listed on the university's website, and those also include health insurance.
Yeah. Next question. Do you have a direct admission without any lab rotation?
For the PhD program, we do not have a direct admission without any lab rotation program. We do offer a master's program that can do a direct admission. but that's a different program.
And then we have a question that I get a lot, which is can an applicant get a waiver for the application fee? So I can answer that. You will need to go to the UW website. They have a process for application fee waiver. It is not controlled by our department, so we do not have any of the waiver available for you to waive this fee. So please look, and then I can also send you the link to their website as well, so if you can email me later. Thanks. Okay. Same thing. So our next question is regarding the English proficiency test score exemption. So again, this is not a determination from the Department of Pharmaceutics. You will need to go online to look at the University of Washington graduate school English requirement. So there's a website for that, and I can send that link to you as well after this. This one we have. Do you integrate machine learning and AI in some projects in the department?
That's a question that's better directed to the individual faculty. There are some folks in the School of Pharmacy who are using AI to conduct molecular modeling studies and perhaps other things, but I am not going to answer for all the faculty on that question at this time.
All right. Next question is, what is the average GPA of admitted students, and is research experience a mandatory requirement?
The average GPA of admitted students varies from year to year, so I can't answer.
We know that again, like in our requirement, right? Like you need to be minimum 3.0. That is actually not a requirement for the department. That is the graduate school requirement. We do not have that average GPA of admitted students at the moment. We're working to collect the data, so to speak, from the past few years. Is research experience a mandatory requirement? Yes, right?
Yes.
Yes. Okay. Next we have a question regarding to international students. So if a international student is on an F1 visa, currently in the US conducting a master thesis and in the program, they're just wondering how many international students would the program accept?
That varies from year to year, and so we can't answer that question at this time.
Right. Melina has a question. She was wondering whether it would be possible to have faculty members from both pharmaceutics and medicinal chemistry departments to be co-PIs.
Co-advisors, we don't typically have it, students operate in that manner because students are admitted into either the pharmaceutics or the medicinal chemistry program, and due to university requirements for our graduate program, graduate student dissertation committees, we have to have faculty from different departments serving as what's called a graduate student rep. So we don't necessarily have co-advisorships, but we tend to have close relationships where faculty from other departments can provide guidance or mentoring, but it's not like a formal co-PIs because the university restrictions don't necessarily allow us to do that.
Next, we have a question from Harold. What academic or professional background or experience do you usually look for in applicants?
I'm sorry to keep saying, it really varies from year to year because it's dependent on the faculty who may be considering taking a student in the next cycle, and that is largely contingent on grant funding availability within a specific laboratory. But I think we tend to, look for the same things over and over again, which is students who demonstrate curiosity, motivation, willingness to work in a translational research environment, because that's a very dynamic and exciting field. And so we want students and trainees to also be equally passionate about our work.
All right, and last here we have a question. Am I eligible for H-1B visa if I am accepted as a PhD student? I can answer that. So you would be on an F1 visa if you become a PhD student. The department, we do not handle the visa process, and we don't really know the process as well as the University of Washington International Student Services. So when you are accepted, if you are accepted into the program, you will have more conversation with those folks at the ISS. And
Can't participants get an app fee?
yeah, we already answered that. Sorry, we don't have a application waiver, fee waiver code.
Great. Well, thank you very much for your time. And if you have additional questions, please feel free to email us at psuit@uw.edu.
Okay. All right, thank you, everyone.
Bye now.